Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Chronic versus acute conditions illness classifications. Acute and chronic conditions typically differ in how they develop and how long they last. Broadly speaking, acute conditions occur suddenly, have immediate or rapidly developing symptoms, and are limited in their duration, for example, the flu. Chronic conditions, on the other hand, are long-lasting. They develop and potentially worsen over time, for example, Crohn's disease. /r/n/r/n. These descriptions can vary somewhat, though, depending on who you speak to or what sources you reference. While the terms may apply in specific circumstances, they don't always, and they often fall short in describing what you may be faced with if given an acute or chronic diagnosis. /r/n/r/n. Most illnesses can be categorized as acute or chronic. These terms can suggest the types of treatment required, how long treatment can be expected to last, and if treatment is appropriate. /r/n/r/n. Symptoms develop quickly. /r/n/r/n. Expected to be brief, typically resolves in less than 6 months. /r/n/r/n. Symptoms have a slow onset and can worsen over time. /r/n/r/n. Persists beyond 6 months. /r/n/r/n. Acute does not mean new, although many newly diagnosed diseases present with acute symptoms. It simply means that symptoms have developed quickly and that some sort of medical intervention is needed. /r/n/r/n. Similarly, chronic should not be construed to mean fatal or something that will inherently shorten your life. It simply indicates that the condition is not curable. Chronic conditions can often be managed, like diabetes or high blood pressure. /r/n/r/n. A newly diagnosed illness can also be labeled chronic if there is no expectation of a cure. Arthritis is one such example. Some extend the definition to include developmental, functional, or visual disabilities that require ongoing care or management. /r/n/r/n. An acute or chronic diagnosis is not necessarily fixed. An acute condition can sometimes become chronic, while a chronic condition may suddenly present with acute symptoms. /r/n/r/n. Certain infections, for example, will progress from an acute phase, in which symptoms appear and resolve after the initial exposure, to a chronic phase, in which the infection persists, but progresses less aggressively. /r/n/r/n. The chronic infection may lie dormant for years in a latent state, only to manifest with new and typically severe acute complications. /r/n/r/n. Syphilis and hepatitis C are two such examples. Both will typically present with acute symptoms that spontaneously disappear, suggesting that the infections have cleared. /r/n/r/n. However, if left untreated, the infections can progress silently and emerge years later with severe complications like tertiary syphilis or liver failure, respectively. /r/n/r/n. The same can occur with non-infectious disorders like rheumatoid arthritis or psoriasis. Both are considered chronic in that they cannot be cured but can be managed with proper care and treatment. /r/n/r/n. Even so, the diseases can have episodic flares in which acute symptoms spontaneously develop and disappear. /r/n/r/n. Most, but not all, chronic diseases will lead to an acute event if left untreated. For example, atherosclerosis can lead to a heart attack or stroke if steps aren't taken to reduce arterial plaque buildup or reduce blood pressure. /r/n/r/n. With early diagnosis and treatment, some chronic disorders may remain subclinical, without readily observed symptoms, and never manifest acutely. These include infections like HIV or conditions like hypercholesterolemia, high cholesterol, which are often detected early and treated before any symptoms emerge. /r/n/r/n. While acute conditions are technically those that begin suddenly without pre-existing symptoms and last temporarily, keep in mind that many acute conditions can become chronic or result in chronic symptoms. /r/n/r/n arthritis /r/n/r/n Alzheimer's disease /r/n/r/n Crohn's disease /r/n/r/n high blood pressure /r/n/r/n diabetes /r/n/r/n cancer /r/n/r/n epilepsy /r/n/r/n heart disease /r/n/r/n clinical depression /r/n/r/n asthma /r/n/r/n broken bones /r/n/r/n heart attacks /r/n/r/n common colds /r/n/r/n burns /r/n/r/n constipation /r/n/r/n stroke /r/n/r/n appendicitis /r/n/r/n bronchitis /r/n/r/n pneumonia /r/n/r/n sinus infections /r/n/r/n as type as that definitions may seem 6 months or more for chronic versus less than 6 months for acute. These timeframes in no way suggest what you may be faced with if diagnosed with an acute or chronic illness. /r/n/r/n After all, an acute bout of the flu does not compare to an acute hepatitis C infection. Neither does HIV, a chronic infection that can be controlled over a lifetime with antiretroviral drugs, compare to multiple sclerosis, a chronic illness that invariably progresses despite treatment. /r/n/r/n In the end, labeling an illness as acute or chronic cannot describe the nature of a disease, nor predict outcomes. /r/n/r/n This non-specificity of definitions not only affects healthcare providers and patients but also researchers who look for concise ways to evaluate the course of a disease. Thresholds are frequently changed from 6 months to 3 months or extended to a year or more, which only adds to confusion. /r/n/r/n Even public health authorities aren't immune to these discrepancies. The U.S. Department of Health and Human Services, HHS, for instance, lists 20 diseases as chronic including stroke, autism, and cancer. The Centers for Medicare and Medicaid Services, CMMS, lists 15, many of which are different from the HHS list. /r/n/r/n Within this context, the definition can often bend to fit the situation. With the HHS, chronic is used to describe a public health concern for surveillance purposes. With the CMMS, the term broadly describes a disease for healthcare utilization purposes. /r/n/r/n There is currently no single consistent definition of either acute or chronic that fits all purposes. This doesn't mean, however, that the terms are unimportant in how they are used between a healthcare provider and patient. /r/n/r/n The seemingly random ways in which these terms are applied can often create confusion in a patient's expectations. /r/n/r/n For example, can cancer truly be considered chronic when only a few types, such as multiple myeloma, are able to be managed chronically? Should a traumatic injury like a broken leg be considered acute even if it fits within the broader definition of the term? /r/n/r/n In the end, defining an illness or injury as acute or chronic may not only not be necessary, but it may confuse more than enlighten. /r/n/r/n Some health experts advocate for a simpler approach to help clear up confusion and inconsistencies. Rather than adhering to a specific time frame or list of conditions, they endorse definitions that express the concepts behind the terms more generally. /r/n/r/n By understanding the concepts rather than the rules, you can have a better grasp of what your healthcare provider is telling you when describing your health condition. But, of course, be sure to ask any questions you have to paint a clear picture of your condition and what may lie ahead. /r/n/r/n Generally speaking, acute conditions develop suddenly, have rapid symptoms, and are typically short-lived, while chronic conditions are long-lasting, developing slowly and often manageable but incurable. /r/n/r/n However, these definitions aren't always precise or universally applied. Some acute conditions can become chronic, and chronic conditions may have acute flare-ups. Always consult your healthcare provider for clarity about your condition. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.